everyone, Charlene Ortiz here. Today I'm going to do a real simple exercise that you can do laying down or on the floor or from bed. And the only piece of equipment I'll be using is just my resistor band right here, which if you've watched any of my videos, I've mentioned many times you can get these for like $1 or $2 on eBay or Amazon, or even a free one from your physical therapist if you're seeing one right now. But they're real cheap and easy to get. All right, so I'm using my pillow right here to help keep my neck from compressing my cervical vertebrae too much if I have real tight shoulders. And so I'm going to go ahead and lay down and just get started with the movement. All right, so I'm first going to show you a real modified, easier way to perform the movement, and then I'll show you more advanced versions from there. All right, so the first version is going to be with your hips on the floor. And we're going to start with just one leg extended, and all you're going to do is bring it in a circular motion, just like that. And you want to make sure that you're keeping that transverse abdominis pulled in nice and tight. And remember, it's like a string attached to your belly button, pulling your belly button back in towards your spine, and that will help to keep your body more stable. You're going to do 5 to 10 rotations going in both directions. So one rotation going clockwise, one rotation going counterclockwise. With this movement, similar to the leg circles I've done in the past that was more for your abdominal muscles, the higher you are and the smaller the circles, the easier it's going to be. The lower you put your leg and the bigger the circle, the harder it's going to be. And as you're going to feel definitely your inner thigh, your adductor engaged. You'll feel your quadricep as well. And you'll also start to feel your glute and your adductor muscle engage. As you start to fatigue, you'll start to feel those muscles engage a little bit more, especially if you add the resistance. And so you'll do, again, 5 to 10 rotations on either side, and you're going to do 5 or 10 clockwise, and then you'll switch and go counterclockwise. If you're having a hard time keeping your body stable, you can put your hand on the opposite leg just to help to keep it from moving too much to the side. And that will help to keep it moving more isolated on the opposite leg. All right, so the next version would be this exact same movement, except you're just going to elevate your hips. And so with this exercise, the higher the hips are elevated, the more challenging it'll be, as long as you're not out of your neutral where you have an excessive lordotic curve down here, which is inappropriate. We don't want to be compressing any vertebrae down there, so we want to still keep that nice neutral position. And so you can, if you want to try the more advanced, then you can just lift the hips just slightly just to see how it feels. But for those of you that are really starting from very, very beginner, I recommend you always start with the most modified version with the hips on the floor. So elevating the hips, it's going to be the exact same thing where you're just going to give me rotation, counterclockwise, and then clockwise, or clockwise, counterclockwise. Whichever one you want to do. And again, I'm trying to keep my body as stable as I can, which is obviously going to be harder because now I'm not on the floor and my hips are going to have to work a little bit harder to have to stabilize me. All right, so the last level of intensity is going to be with the resistor band. So I'm just going to take the resistor band and put it around the top part of my leg. Okay, and you want to try to make it, open it up as wide as you can, and that will just make it, give it the ability to stretch a little bit better. All right, so I'll start with my legs on the floor, and so again, you can start with the more modified version with the band. I want to flatten out here, and then you can go on to the more advanced version. So I'm going to start again just laying down. And I'm doing the exact same movement, and the only difference is I'm using some resistance. And I certainly am feeling a significant difference in how much harder my glutes are working, that's for sure. Okay, and then again, you would just do the other direction, and then you would do, of course, the other leg, for a few repetitions. Of course, I'm only doing like 3 or 4, just for the sake of time, because I'm sure you don't want to watch me work out the whole time. All right, and then the next, obviously the most advanced would be to do the same movement and your hips are elevated, and again, you're doing a nice circular motion and you're keeping the body as stable as you can. And that's where your transverse abdominis is going to come into play. And keeping that transverse abdominis pulled in, keeping that belly button pulled in towards your spine is really going to contribute tremendously to your ability to maintain stability when you're doing this movement. And you also want to make sure that you're keeping your shoulders nice and relaxed while you're doing it. You don't want your shoulders to come up or anything like that, especially as you elevate. And so this will just help to keep movement in your hips and just again to keep the blood circulating and just to keep movement in your body going in general, especially for those of you that are having a really difficult time getting out of bed right now and maybe you're bedridden. So that'll be a really good simple exercise that you can do, and it will help again to strengthen your inner thigh, your glutes will be engaged, your abductors will be engaged, your quadricep muscle will be engaged as well. And there's other versions, different ways that we can kind of do that movement too, which I'll do in another video. But yeah, you want to maybe try 2 to 3 sets of 5 to 10 rotations clockwise, and then counterclockwise the other way, keeping your body nice and stable and trying not to, let your body rotate or rock back and forth too much. So, and remember to breathe. I didn't mention that when I was actually performing the movement, but remember to breathe. So, all right, guys, thanks for watching. And if you're going to incorporate this into your routine, you want to do this maybe, maybe 2 to 3 days a week. You can try doing it every day if the intensity isn't too great, depending on, again, how difficult it is for you, because if you need a day of rest in between, you don't want to push yourself too hard because you don't want to cause muscle damage by straining your muscles at a higher intensity if it's a high intensity for you and not giving them a day to rest. So you can start with 2 to 3 days a week with this exercise, and even incorporate it with the other movements that I've been doing every week with the exercise of the week. So, all right, guys, thanks so much for tuning in. If you have any questions or comments, please comment below. And I really do try to respond to every single comment. And I will try to clarify on anything that might not make sense. Remember to subscribe to the channel so that you never miss out on any future exercises or videos, just to help those of you improve the quality of your life that are dealing with any type of limitation or chronic illness. Remember, take care of yourself, protect yourself physically and emotionally, and don't forget, your health is your most valuable asset. Invest in it. Bye-bye.